Hello and welcome to Beyond Freud. In this video, we will be continuing from where we left off in the last video, that is talking about the various types of listening which Salman Akhtar has proposed in his work Psychoanalytic Listening. Here I will be covering chapter 3, 4 and 5, the final of this series, having covered chapter 1 to 2 in the previous video, and I have decided not to cover chapter 6 and 7 in any video as of now. Beginning with chapter 3. So the actions which the patient exhibits within the clinical situation are divided into three: nonverbal communication, acting in, and enactment. So while nonverbal communication is a much discussed topic, enactment and acting in are particularly crucial categories, I believe. The term acting in was coined to distinguish it from acting out during the analytic session. So acting in happens within the clinic, acting out is what is happening outside the clinic. Acting in is specifically a behavior, as Akhtar notes in its definition, to be a muscular expression of the thought process. Something extra transferential, fantasies or unconscious transference-based desires are being put into actions. So what the analyst then has to listen to, as per Akhtar, is its communicative value. Is it a resistance or the only known form of communication to pre-verbal material? On the other hand, enactment is dominantly understood as a patient having unconsciously induced the analyst to live out a transference fantasy. So wishes and fantasies of the patient, they tend to take on a behavioral form, which then starts to feel real in the work. After actions, we also have the notion of listening to oneself. That is, the analyst listening to themselves. We also know this as countertransference, as a counter to transference. Akhtar provides us with a short literature review of the movement of the notion throughout the history of psychoanalysis and brings to our understanding that it is an unconscious instrument which equally is a product of the analysis as transferences, and it is to be utilized rather than to be treated as an obstacle. The analyst must keep an eye on the counter-transference. This is very important to undertake deeper work and also to not lose the essence of spontaneity, which is a part of this notion. So how are we listening to this counter-transference? And what makes up this counter-transference? Akhtar provides us with 4 categories for our ease, and he does tell us that these are very superficial categories, so do keep that in mind. So the analyst has to listen to their associations, their emotions, impulses, and actions. So in a session, the analyst is listening at 2 levels. The first is the patient's associations, their silences, their nonverbal communication. Alongside this, the analyst is also listening to themselves by what Akhtar phrases as giving in to the patient's content. So it's a kind of psychic malleability, which allows the analyst to get in a state where associations arise within. So it's like a kind of free association for the analyst as well. So while this is free floating, the analyst can then also tap into their subjective experience of the patient. So all of these layers combined together inform us of the patient's concerns and transference developments. Akhtar proceeds to provide us with clinical examples of the same, something which he does throughout the chapter, and then discusses when and how is one to share these associations with their patient. Coming to listening to one's emotions, so there are 3 ways in which you can listen to your emotions in the therapy space, as per Akhtar. The first is emotions which are felt towards the patient. Then there are emotions which are felt with the patient, and lastly, emotions which are felt on behalf of the patient. So this, the third one, it involves projective identifications of what the patient is unable to handle. Emotions are different from impulses here, I believe, as each can be the motivator of the other. Listening to one's impulses means feeling that one is impelled to do something. There is a sense of pressure, both positive actions and also for negative actions, whose intensity and duration vary. So what this means for the work, as Akhtar observes, is that the therapist has come in contact with the deep aspect of the patient, and this can be something which has been disowned by the patient, which is then showing up in the therapist. When Akhtar talks about listening to one's actions, he is referring to those actions which have been acted out in the work. And often it is in retrospect that we are able to think about what has happened. We have to keep in mind that all these types of listenings do not happen at one at a time, but they are occurring simultaneously at different layers of the work. Actions can be anything from something really small like a facial expression or something which is very prominent. Akhtar quotes Jacobs, who talks about empathy in this context. Empathic understanding and consequent temporary ego regressions give rise to what we had mentioned in the previous video as body empathy. In discussing this section, Akhtar repeatedly warns us to exercise caution and vigilance in trying to understand the enactment and the need to work things out with the patient slowly and steadily. In the chapter on listening poorly, Akhtar enumerates a number of reasons which can result not in temporary disturbances of the work, such as loud noises outside, but much deeply embedded circumstances which might impact the whole of the therapeutic work. So he lists them as hearing impairment, characterological resistance, conceptual rigidity, countertransference blocks, cultural differences, and language problems. These are vital to understand because they also include the question of how can psychoanalytic work go beyond the clinic. A clinic as an office within four walls and which your patient comes to is not a possibility in all situations and geographical locations, especially with the rise in online work post COVID-19 in countries which are dealing with also with a lot of post-colonial school of thought. The possibility of listening poorly then instead can give rise to question of what does it mean to listen to correctly in this context. When it comes to characterological resistance or conceptual rigidity, Akhtar is pointing out a worry which all therapists, especially in the beginning of their work, will face. Is there a school of thought one has to stay loyal to? Is there only one truth? Can work be undertaken even when there is no desire to listen? So these are important questions, and Akhtar discusses how qualitative differences arise in the manner of each individual's listening, but he brings up the harmful possibility of a quantitative difference in which the act of listening is tainted by the analyst's own impinging desire to be a certain figure in the patient's life or having no desire to listen. In discussing how he sees listening to be a maternal act, and this is a wonderful portion of the book, Akhtar is differentiating in listening without placing ourselves as primary in the analytic work and a listening in which there is a desire to be seen as a listener. Conceptual rigidity in continuation with this can also taint a listening when it is a rigidity the analyst is not willing to forsake. Flexibility then, seems to be the key here, which I feel will also aid us in dealing with countertransference blocks. Total identifications and countertransference, which is not worked through in therapeutic work or supervision, can make listening difficult as well. So this brings us to the end of our discussion of Salman Akhtar's book, and as I stated in the beginning of the video, I will not be discussing the chapters which are left. I believe there are 2 chapters which I had said. So we'll be ending over here. See you then for the next video, and thank you for watching this one.